Look down at your ankles right now, especially if it is late in the day. Do your socks leave a deep line pressed into your skin? Do your shoes feel tighter than they did this morning? Maybe both ankles look puffy, heavy, or shiny, even though your heart tests, kidney tests, blood pressure, and basic blood work all came back normal. Many people over 60 hear the same explanation. It is probably age, poor circulation, or too much sitting. Then they are sent home with the swelling still there and no clear answer. But in many cases, the missing piece is not the heart or kidneys. It may involve the body's drainage network, known as the lymphatic system. When this system slows down, fluid can collect in the lowest parts of the body, especially around the feet and ankles. The lymphatic system may sound complicated, but its basic job is simple. Your body has two major transport networks. The first is the cardiovascular system, which moves blood through arteries and veins. It has a strong pump, the heart, working every second of the day. The second is a much finer network of vessels. It collects extra fluid that escapes from blood vessels into surrounding tissue, carries away waste, and moves that fluid through lymph nodes where it is filtered. Think of it as a drainage system running beside your blood circulation. Here is the difference that matters most. The lymphatic system has no central pump of its own. It depends heavily on movement. Every step, ankle bend, calf contraction, and climb up a stair squeezes the small lymph vessels and helps push fluid upward against gravity. Your muscles act like the pump. When those muscles move less often, the flow slows, and fluid may begin collecting around the feet and ankles. That is one reason swelling often becomes more noticeable after 60. People may sit longer because a knee hurts, balance feels uncertain, energy is lower, or walking becomes uncomfortable. This is not laziness. It is usually a gradual change in daily movement. A few more hours in a chair, fewer stairs, a shorter evening walk, or more time resting can quietly reduce how often the calf muscles squeeze those drainage vessels. Modern medicine is very good at looking for emergencies. When someone reports swollen ankles, doctors may check the heart, kidneys, blood pressure, veins, and circulation. Those tests matter because serious causes must be ruled out. But when everything appears normal, the problem is sometimes treated as if nothing useful can be done. There is a large space between dangerous disease and a perfectly working body. A system can be working poorly without being completely broken. The swelling itself is called edema, which simply means fluid has collected in soft tissue. Sometimes heart disease increases pressure in the veins and pushes fluid outward. That is serious and requires proper treatment. Another possibility is that fluid is entering the tissue normally, but the drainage system is not carrying it away efficiently. This slower movement is sometimes described as lymphostasis, meaning the fluid that should keep flowing has slowed or stopped. Several age-related changes may arrive together. Lymph vessels can become less flexible, muscle activity falls, thirst signals weaken, and hot weather widens blood vessels, so more fluid enters surrounding tissue. The result may be ankles that look nearly normal in the morning, become larger by evening, and improve when the legs are raised. But before discussing any home routine, there is an important safety line that nobody should ignore. Swollen ankles are not always a harmless result of age or reduced movement. Some patterns need urgent medical attention, and trying to treat them at home can waste valuable time. If swelling appears suddenly over a few hours or overnight and affects only one leg, it may point to a blood clot deep inside a vein. That needs medical care quickly. If swollen legs come with chest pain, shortness of breath, faintness, confusion, or a racing heartbeat, do not wait for a morning routine to help. Seek urgent medical attention. Red, hot, painful skin, accompanied by fever, may be a sign of infection. Swelling that continues getting worse, does not improve after raising the legs, or appears with sudden weight gain, reduced urination, or breathing trouble should also be examined. A video cannot diagnose the cause, and no exercise should replace a medical assessment when warning signs are present. The pattern discussed here is different. It usually affects both legs, becomes worse toward evening, improves after lying down or raising the feet, and appears after serious heart, kidney, or circulation problems have already been checked. In that situation, reduced movement and slow fluid drainage may be contributing factors. Why does this become more common with age? The first reason is that the small vessels involved in fluid movement may become less flexible. Like skin and arteries, they can lose some elasticity over time. The second reason is reduced muscle activity. You may still think of yourself as active, but compared with your 40s, you may take fewer steps, spend longer sitting, and use stairs less often. Every missing movement means the calf pump is working less frequently. The third factor is hydration. The sense of thirst can weaken with age, so many older adults drink less water without noticing. This sounds backward because people with swollen feet often think water must be making the swelling worse. But unless your doctor has told you to limit fluids because of a heart or kidney condition, adequate hydration helps normal circulation and fluid movement. When you drink too little, body fluids can become harder to move efficiently. The fourth factor is heat. Warm temperatures widen blood vessels and allow more fluid to enter surrounding tissue. If your drainage system is already moving slowly, hot weather can make ankle swelling much more obvious. Very hot baths, thick socks in summer, heating vents aimed at the feet, and long afternoons outdoors may all make the problem worse. The encouraging part is that muscle-driven fluid movement may respond to small actions repeated consistently. You do not necessarily need a gym, complicated equipment, or an exhausting workout. The routine begins before you stand up in the morning. While still lying in bed, place 1 or 2 pillows under your lower legs so your ankles and calves are raised above the level of your heart. Remain there for 1 full minute. Gravity now works in your favor, allowing pooled fluid an easier path back toward the center of the body. Next comes the ankle pump. With your legs still raised, point your toes away from your body, then slowly pull them back toward your shins. Continue this movement for 1 minute. Each flex contracts the calf muscles and places gentle pressure on nearby vessels, helping move fluid upward. After 1 minute, rotate your ankles slowly. Complete 10 circles in one direction, then 10 in the other. The movement may look too simple to make a difference, but the goal is not to tire your legs. It is to activate muscles that may have remained still for hours. Once those muscles begin working, the next stage uses another pressure system inside your body, one that moves every moment but is rarely connected with swollen ankles. Your breathing. The diaphragm is the large muscle beneath your lungs that controls much of your breathing. When you take a slow, deep breath into your belly, the diaphragm moves downward. This changes pressure inside the chest and abdomen, helping draw fluid upward through larger lymphatic pathways. In simple terms, your breathing can act as another gentle pump. Keep your legs raised and breathe slowly through your nose for 4 seconds. Let your belly rise instead of lifting only the upper chest. Hold the breath for about 2 seconds, then breathe out gently through your mouth for 6 to 8 seconds. Empty your lungs without forcing the air. Repeat this pattern 10 times while continuing the ankle movements. Slow breathing also helps calm the nervous system. That may reduce physical tension and make the routine easier to follow each morning. There is no need to strain, breathe rapidly, or hold your breath until you feel dizzy. The movement should feel steady and comfortable. The fourth part is gentle massage. Sit on the edge of the bed and place both hands over the top of one foot. Using light pressure, slide your hands from the toes toward the ankle, then from the ankle toward the calf and knee. Always move upward toward the body rather than pushing back down toward the feet. The lymphatic vessels sit close to the surface, so hard pressure is unnecessary. You are not trying to knead the muscles. Use about as much pressure as you would use to wipe a window with a soft cloth. The skin should move slightly beneath your hands, but the massage should not hurt or leave bruises. Spend about 1 minute on each leg. Together, the position, ankle pumping, deep breathing, and upward massage take around 5 minutes. The value comes from repetition. Doing it gently every morning for several weeks may be more useful than performing a long routine once and forgetting it for the rest of the month. The morning routine is only the beginning. What you do during the day can either keep the legs moving or allow fluid to settle again. The first habit is hydration. A general target of around 1.5 to 2 liters of fluid each day may suit many adults, but that number is not right for everyone. People with heart failure, kidney disease, or other conditions may have strict fluid limits. Follow the amount given by your own doctor rather than a general number from a video. Movement throughout the day also matters. You do not need to complete a full workout every hour. When sitting for long periods, stand up roughly every 45 minutes when it is safe to do so. Take 10 steps, walk to another room, or perform several ankle pumps beside the chair. The goal is simply to restart the calf muscles before another long period of sitting. Avoid placing strong heat directly on swollen legs. Very hot baths, Heating pads, radiators, and heavy socks during hot weather can widen blood vessels and send more fluid into tissue. Comfortable warmth is different from intense heat, but notice whether your swelling becomes worse after certain routines. Salt deserves attention as well. Sodium causes the body to hold more fluid. This does not mean removing every grain of salt from your diet. The larger problem is often hidden sodium in deli meat, canned soup, processed meals, salty snacks, sauces, and packaged foods. Someone who eats several high-sodium foods during the day may notice tighter shoes by evening. Reducing those foods can make a visible difference, but another long nightly habit may matter just as much. While you sleep, your body has several uninterrupted hours to move fluid away from the lower legs. Raising the feet slightly may help gravity support that process. A thin pillow beneath the lower legs may be enough. Some people raise the foot of the mattress by several inches, but the position should remain comfortable and should not create back, hip, or knee pain. The emotional side of unexplained swelling is often ignored. Imagine a woman in her early 70s who still walks her dog each morning and considers herself active. Over one summer, her ankles begin swelling so much that she cannot put on her usual shoes by dinner. She gets blood tests, heart checks, and circulation tests. Everything appears normal, but nobody explains why her legs still feel heavy. Instead of feeling reassured, she becomes more frightened. When the body sends a signal and nobody offers an explanation, the mind often fills the silence with the worst possible outcome. She may begin wondering whether she will lose her mobility, need help from her children, or become unable to live independently. That fear is understandable. It can also make the experience harder. Long periods of stress can affect sleep, activity, eating habits, and inflammation. A person who is frightened by swelling may move less because she worries that walking will make the problem worse. Less movement then reduces the muscle pumping action that helps fluid return. Fear can quietly strengthen the very routine that allows the swelling to continue. Clear information changes that relationship. Understanding does not guarantee that every symptom is harmless, but it gives you a sensible next step. You can learn the emergency signs, speak with your doctor, and take practical action instead of feeling trapped inside a body that no longer makes sense. In this example, the woman begins the 5-minute morning routine. She raises her legs, performs ankle pumps, uses deep breathing, and applies gentle upward strokes. During the day, she drinks the amount of fluid approved by her doctor, stands more often, reduces heavily salted packaged foods, and keeps strong heat away from her legs. Compression stockings may also be suggested for ankle swelling, and they can be useful. They apply outside pressure to the legs, helping support the movement of fluid upward. But they must be used correctly. Compression stockings are usually easiest to put on in the morning before swelling has increased. Waiting until the middle of the day may mean trying to compress a leg that is already much larger. Mild stockings sold in pharmacies may suit many people, but stronger medical compression should not be used without professional advice. This matters because not every circulation problem responds safely to strong compression. People with certain arterial conditions, skin infections, severe pain, numbness, or poorly controlled medical conditions may need individual guidance. A stocking that is too tight, rolled down, folded, or poorly fitted can place excessive pressure on a narrow part of the leg. Compression should also be treated as support, not the entire answer. Wearing stockings while remaining seated all day may help temporarily, but the swelling can return when they come off. Combining compression with movement, hydration, leg elevation, and the morning routine gives the body several forms of support, instead of relying on one garment. The next question is usually about timing. How quickly should you expect the swelling to change? The honest answer is that it depends on the cause, how long the swelling has been present, your general health, medications, movement level, and whether another medical condition is involved. Promising a dramatic result after one morning would be careless. Changes, when they happen, are usually gradual. During the first week, you may notice that your ankles look less swollen when you wake up, or that the swelling takes longer to appear during the day. By the second week, the heavy or tired feeling in your legs may begin to ease. By the third week, some people may notice that evening swelling is less severe and the skin around the ankles feels softer and less tight. These results are not guaranteed, and persistent swelling still deserves medical attention. But the pattern teaches an important lesson. The body often responds better to small actions performed every day than to one intense effort performed occasionally. 5 gentle minutes each morning can be easier to maintain than a long routine that leaves you sore and is quickly abandoned. Return to the woman from the earlier example. After several weeks, she notices she can wear her usual shoes later into the day. No dramatic treatment took place. She simply gave her legs more support through movement, elevation, breathing, hydration, and better daily habits. The routine did not replace her medical checks. It became something practical she could do after serious causes had been considered. Here is the full morning sequence again. Before getting out of bed, place 1 or 2 pillows beneath your lower legs and raise the ankles above your heart for 1 minute. Next, point the toes away and pull them back toward the shins for another minute. Add 10 slow ankle circles in each direction. While moving the feet, take 10 slow belly breaths. Breathe in through the nose for 4 seconds, pause briefly, and breathe out through the mouth for 6 to 8 seconds. Sit up carefully, then use light upward strokes from the feet toward the knees for about 1 minute on each leg. Move slowly when standing, especially if you sometimes feel dizzy in the morning. Sit on the edge of the bed for a moment before rising. Use support when needed, and never perform a movement that creates sharp pain, chest discomfort, breathlessness, or sudden weakness. During the day, avoid sitting motionless for several hours. Stand, walk briefly, or perform ankle pumps around every 45 minutes when practical. Drink the fluid amount approved for your medical needs. Reduce heavily processed foods that contain large amounts of sodium. Avoid strong heat on swollen legs, and consider gentle elevation while sleeping. Also pay attention to patterns. Does the swelling appear after a salty meal? Is it worse during hot weather? Does it improve after walking or elevation? Is one leg consistently larger than the other? Keeping a simple written record can help your clinician understand what is happening far better than trying to remember every detail during a short appointment. Write down when the swelling begins, whether it affects one leg or both, any pain or redness, recent medication changes, and whether raising the feet helps. Some blood pressure medicines and other prescriptions may contribute to ankle swelling. Do not stop medication on your own, but ask your doctor whether a medicine could be playing a role. Swollen ankles may seem like a minor annoyance, yet they can affect walking, balance, footwear, sleep, confidence, and independence. That is why the problem should not be dismissed simply because initial tests were normal. Normal tests can rule out certain dangers, but they do not mean your discomfort is imaginary or unimportant. At the same time, it is vital not to assume every case is caused by slow lymphatic drainage. Swelling can have many causes, and the next section draws the final line between a routine you can discuss with your doctor and symptoms that should never be watched casually at home. Seek urgent medical help when swelling begins suddenly in one leg, especially when the leg is painful, warm, red, or tender. A clot can move to the lungs and become life-threatening. Chest pain, sudden breathlessness, coughing blood, fainting, confusion, or a racing heart are emergency signs. Do not massage the leg or wait to see whether ankle pumps make it better. Fever with hot, red, painful skin can point to infection. Sudden swelling with reduced urination, rapid weight gain, or difficulty breathing may involve the heart or kidneys. New swelling during pregnancy, after surgery, following a long period of immobility, or after a major injury also deserves prompt professional advice. Even without emergency symptoms, arrange a medical review when swelling is new, persistent, repeatedly getting worse, painful, or not improving with elevation. One leg, remaining consistently larger than the other, should also be discussed. The goal is not to frighten you. It is to make sure a simple routine is used only when it is appropriate. Once serious causes have been ruled out, the daily plan is straightforward. Begin with 5 minutes before leaving bed. Raise the legs, pump and rotate the ankles, breathe deeply into the belly, and use gentle upward strokes. During the day, break up long periods of sitting, drink according to your doctor's guidance, reduce heavily salted foods, avoid excessive heat, and raise the feet when resting. Compression stockings may provide added support, but choose the correct strength and fit with professional guidance, especially if you have diabetes, numbness, skin problems, or known circulation disease. Put them on early in the day before swelling increases, keep the material smooth, and remove them if they cause severe pain, numbness, unusual skin color, or worsening discomfort. Most importantly, Be consistent without becoming obsessive. Missing one morning does not destroy your progress. Return to the routine the next day. The body does not need punishment. It needs regular movement and sensible support. Pay attention to what your ankles are telling you. A deep sock line at the end of the day is not a diagnosis, but it is useful information. It may show that fluid is collecting, that you have been sitting too long, that heat or sodium is affecting you, or that a medical review is needed. You are not weak, because your body works differently after 60. Muscles change, thirst signals become quieter, joints may hurt, and movement can become more difficult. These changes are real, but they do not remove every choice from your hands. A few minutes of movement, safer daily habits, and clear medical guidance can help you work with your body instead of feeling frightened by it. Tomorrow morning, before your feet touch the floor, place a pillow beneath your legs and begin with 1 slow minute. Point your toes, pull them back, rotate the ankles, and breathe deeply. Keep the movements gentle. Notice how your legs feel before and after, and continue the routine consistently rather than expecting one dramatic overnight result. Everything in this video is for general education. It is not a diagnosis, personal treatment plan, or replacement for advice from your own doctor. Medical history, medications, heart function, kidney health, circulation, and other conditions can change what is safe for you. If this video helped you understand why your ankles may swell, subscribe to the channel, give the video a like, and share it today with someone who keeps struggling with heavy, puffy legs. Leave a comment with your age, where you are watching from, and whether your swelling is worse in the morning or evening. Your experience may help guide a future video, and it may help another viewer realize they are not dealing with this alone.